Hi, my name's Kim. I'm a nursing instructor. I'm teaching a fundamentals nursing program in the practical nursing program at North Idaho College. Today I'm going to be teaching about how to insert a urinary catheter. I will not be actually inserting it, but I will be showing the part where you set up a sterile field and make sure everything stays sterile until you go to insert it. I will preface it by saying that it would be way easier if bacteria was brightly colored, because then we could see where bacteria was and we would never touch it. But because that isn't the case, you have to assume that there is bacteria, even if you wash your hands very well and use sterile technique. It is easy to break sterile technique. So what I'm going to teach you today is how to best insert a catheter without breaking sterile technique. So what you need to start the catheter in a patient is everything in this box. It's called a Foley urinary catheter. It comes with several things. It comes with an underpad that you put under the patient before you start, and that's a semi-sterile area where you can keep what you're doing as sterile as possible next to the patient. Then there's a drape, which is completely sterile. There's sterile gloves, which after you set up everything in the kit, you then put on your sterile gloves and then you touch everything in the kit. And that way everything stays sterile once you put on your gloves and you don't really touch anything. I'll show you how this goes. There's iodine solution that you prep the patient with to get them as clean as possible. There are cotton balls. There's lubricating jelly. There's a 10 cc syringe of sterile water, and there's a specimen container if you wanted to get a sterile specimen of urine. So the first thing that you do is you open your kit and you pull it out. This bag that it came in can actually be used as a garbage bag. So you would pull down the top, open that up, and you put that right next to your patient to drop everything in as you use it. So I'll do that as I go, just to demonstrate. Okay, so you never want to reach across a sterile field. So this is our everything is sterile in here. So the way that you open a bag like this, or a box, is first you go forward, then you go to the side, to the other side. I'm sorry. And then you pull the last one forward toward yourself. That way you've never reached over your sterile field. Then I'm going to set this down. The first thing that's in here is a drape that you hold just by the corner, and then you open it up like this, and you go over to the patient and you place it under them, right between their legs. That just gives you a space where instead of doing it right over a sheet, you actually have this semi-sterile drape that you use to keep the person as sterile, the whole situation as sterile as possible. All right, the next thing in the kit, without touching anything else, is a pair of sterile gloves. Now these are in their own sterile packaging, so there's not a problem with taking these out and laying them down until you're ready to use them. And in the meantime, I'm going to get everything else ready that I can touch without breaking sterility or breaking the aseptic technique. So the next thing that you would do is take out this center little box. And what's in here is cotton balls, iodine that you pour on the cotton balls, and this is once you're sterile, and then a little lubricating jelly that you dip your catheter into. So I'm just going to place this down. Then what's inside of the rest of the box is the catheter bag itself, and then this is the catheter that you place inside the patient. Now this is covered with a blue covering, which is sterile, and if you do it very carefully, you can actually remove this blue sterile covering without touching the inside catheter, and then you remove that and get rid of it. And as you can see, I never touched it, and now the catheter is laying in the box as and that is sterile. So everything in here is sterile. Everything in here is sterile. So now, in order to connect everything, I need to put on sterile gloves. So first I would do hand hygiene. I'd wash my hands really well, or use gel. I like to wash my hands. I think it does a better job. So you do that for a minute or so, and then you dry them. Then you put on your gloves. And the way that you put on your gloves is you open up the kit. You hold the glove by the inside part that will not need to stay sterile. You put your hand in it, and that is a sterile glove. Then you take your next hand, you dive into the other glove. So now I'm touching the other glove, but it's not touching anything that's not sterile. You put your fingers in, as well as your thumb. Whoops. And it's okay to do this because I can twist it around without getting unsterile. So nothing, I have not touched anything. Now I can go like this, and nothing is not sterile. So this has remained sterile. The next step that you do is you open your iodine, and this is how you clean your patient. And you pour these over the cotton balls. So those cotton balls are ready to be used to clean your patient. And you would use these forceps to pick them up and clean your patient with. So this is all sterile and ready. Then this is your lube. You want to be able to dip the end of your catheter in the lube, so you just squirt that out right in here. And the last thing that you do is take your sterile water. You take the tip off of it. Now I'm all sterile, so I can now touch this without a problem. There's a little port right here that you attach the water to, and you lay it back in here, and you're ready to go. So everything now is sterile and ready to go until you are ready to insert the catheter into your patient. And that's it. Thank you so much.